Let's discuss the supplies needed for newborn care, including emergency equipment. But first, legal disclaimer. By the end of this presentation, you should be able to identify the necessary newborn care supplies and equipment that midwives should be familiar with. You will have a better understanding of emergency equipment that all midwives should have for birth and the postpartum newborn management. You should also understand the importance of proper use of that equipment. Midwives should have available certain supplies in order to safely care for newborns. Also, proficient use of equipment will assist the midwife in reducing newborn risk for morbidity and mortality. Along with proper use of equipment, hand hygiene and proper cleaning and maintenance of equipment should also be prioritized. Equipment needed for newborns will allow midwives to provide appropriate cord care and allow for complete head-to-toe assessments. Certain equipment will be used for different assessments and screenings. There also will be times where the newborn will require resuscitation, even if the very minimal, such as the use of a bulb syringe. Some equipment used will be specific to each birthing center and/or state requirements. For example, screening for critical congenital heart defects or CCHD may vary by state. Also, proper waste removal, it will vary at each site. For starters, having a good lighting and a good heating source is critical. Reason being, the risk of hypothermia is increased in the newborn. Midwives can reduce heat loss by ensuring the room is warmed, and heating pads are accessible if the newborn's temperature consistently falls below 36 degrees Celsius. The normal temperature for a neonate, it ranges between 36.5 to 37.7 degrees Celsius. In general, delivery rooms are kept at a temperature that is both comfortable for the delivering mom and for the attending staff. Hand washing should remain consistent with clean water supply. Soap and the use of clean towels should be available. Waste baskets should be readily available in the delivery room to properly dispose of the placenta and soiled gauze or linen. Storage of the placenta should be provided, and to prevent contamination and needle sticks, the room should have a sharp container. As a newborn transitions from extrauterine life, many of these supplies are critical in assisting the newborn, ensuring that they are thriving. Standard equipment used during delivery and in the postpartum period are listed here. Those deliveries that are considered mild to moderate risk will require the newborn to have a heat source, such as a warmer. Oxygen, suction, and intubation equipment also should be readily available. Standard medications administered shortly after delivery includes erythromycin eye ointment and vitamin K. Dopplers are vital in the care of the newborn, especially during delivery when utilizing intermittent auscultation in between contractions. For the midwife that encourages water births, the use of a waterproof Doppler is also encouraged. Although not a requirement, but a provider preference, the use of an umbilical cord scissor is optional. It is typically used without the need for clamping since it's designed to hold the cord in place, minimizing cord damage and reducing risk of infection. There are differences between a commonly seen stethoscope compared to an infant stethoscope, such as the dual-sided chest piece, with its small diaphragm, ideal for the little patients, such as our newborns. It provides the midwife high acoustic sensitivity for both high and low frequency sounds. An ophthalmoscope is used to evaluate the external structures of the eyes, including the eyelids, the motility, eye muscle balance, pupil, and the red reflex. The red reflex test can be performed relatively quickly, as well as non-invasively. This test has shown to have high sensitivity for testing abnormalities in both the anterior segment and posterior segments of the eyes. And a normal red reflex can rule out intraocular pathologies such as cataracts or retinoblastoma. In contrast, an abnormal reflex or an abnormal red reflex indicates the need for a referral to ophthalmology for a more comprehensive evaluation. Erythromycin eye ointment, it is intended to kill or weaken bacteria in the eye, more specifically gonorrhea and chlamydia, as these infections can cause serious eye damage and blindness if left untreated. Current recommendations in the U.S. is to administer erythromycin in the eyes of the newborn within the first 24 hours of birth for prevention, even if the mother's STI status is unknown. Vitamin K is needed to help the body clot and stop bleeding. Because all babies are born with low levels of vitamin K, supplementation is recommended at birth. Typical administration is a sub-Q injection within hours of delivery. The midwife should have readily available proper syringe and needle supplies. Vitamin K should be drawn up in a filter needle and administered in a 1 ml syringe with a 25 gauge needle. 70% alcohol or swabs should be used for antibacterial and first aid purposes. Use as a disinfectant before all injections. A pulse ox is used to screen for critical congenital heart disease, or CCHD. 1 in every 100 newborns will have a congenital heart defect at birth, and 25% of those babies will go on to develop CCHD. This screening is done after the first 24 hours of life and uses a pulse oximeter for assessing the oxygen levels. Different needle gauges and lengths are recommended depending on the age of a newborn and site of injection. For injections of the anterolateral thigh muscle or subcutaneous, use a 5/8 inch needle and a 22 to 25 gauge. Listed here are the required equipment for newborn resuscitation. The newborn is more likely to need resuscitation in certain situations and should be anticipated. For example, newborns are at an increased risk if there was meconium in the fluid, fetal heart rate abnormalities such as decelerations, maternal fever or choreo, maternal diabetes, a prolonged rupture of membranes, cesarean deliveries, and deliveries requiring mechanical assistance. A metabolic disorder is one that gets in the way of how the body breaks down food, absorbs nutrients, or handles enzymes. If left untreated, some of these disorders could affect a baby's development. It can also go on to cause organ damage or even death. A heel stick sample is collected around 24 to 48 hours after birth. Supplies needed includes newborn heel sticks, sample cards from the state, alcohol swabs, gauze, and Band-Aids. Newborn hearing screening is done before going home from the birthing center or hospital. using the AABR method, or Automated Auditory Brainstem Response. Clicks or tones are played through soft earphones into the baby's ears. 3 electrodes are placed on the baby's head, measuring the hearing nerve and brain's response. Some midwives are trained with this equipment. However, most do refer to an audiologist or hospital in the community. In conclusion, as midwives support mothers and babies, newborn care equipment should be just as important as the pregnancy. The most important thing is to make sure that every piece of equipment being used is safe, sterile, and/or clean based on its needs. Making sure all the equipment is present and in proper working condition to accurately assess if the baby is transitioning well into extrauterine life.